Ladies and gentlemen, I'm delighted to have the opportunity to address you at this important summit, and I apologize that I just can't do so in person. Healthy people are central to achieving all of the Sustainable Development Goals, a prosperous and healthy planet, and the future that we all want. And we need progress in all SDGs if we are to achieve the global health targets and ensure no one is left behind. 50% of recent gains in women's and children's health under the Millennium Development Goals were actually the result of factors outside the health sector. So to make the vision of the 2030 Agenda for Sustainable Development a reality, we must work together to achieve universal health coverage and access to quality healthcare for all. Accelerating the progress that's been made so far in reducing maternal, newborn and child mortality will lead to an end to all preventable deaths in these domains before 2030. Germany has long been a champion for the crucial areas of this agenda, from addressing health in emergencies, building resilient health systems, to tackling emergent threats like antimicrobial resistance, and doing this always through multi-sectoral and multi-stakeholder action. The 2030 Agenda for Sustainable Development is an integrated and interconnected agenda. It recognizes what many of you already know so well, that non-health challenges need to be addressed to meet the targets of the health-related Sustainable Development Goals. Here's some examples. Maintaining peace is essential for global health and development in all nations. Human rights must be respected, and people must be empowered if they're to be healthy, especially if they are people with disabilities, if they're people living with HIV/AIDS. And this applies to children, to older people, to indigenous people, to refugees and migrants. Women and girls need to enjoy equal access to quality education, to economic resources, to political participation, as well as a clean and healthy environment, and to decision-making at all levels. All of these transformations require country ownership and robust long-term political will, so that the goals can be translated into specific plans and national development strategies. And to achieve such results, countries require a mix of domestic and external resources mobilized intensively so as to ensure scale-up and sustainability of proven interventions. Now, to get there, one issue is particularly important. Transparency among all actors and accountability for what's achieved are key for ensuring that people, wherever they are, can own and can be committed to results. Because unless this is done, the results won't be achieved. So to get there, civil society has an absolutely vital role to play. The 2030 Agenda for Sustainable Development puts a lot of emphasis on follow-up and review processes within countries as the basis for accountability. And the high-level political forum has a central role in overseeing this follow-up and review at the global level. But in order to get there, country action is key. And in order for countries to be able to initiate the accountability that's necessary, data are key. And this has to be disaggregated data. And so that means investing in building capacity for data collection and for data analysis so as to promote effective monitoring and evaluation. Here's an example. Almost 230 million children under 5 years of age are just not registered. And that means that health information systems have to start with proper registration and then the relevant data collection systems as a priority so that there can be disaggregated analysis. And then we should add to this better collaboration between health and other sectors with national statistical offices. The private sector does play a key role in ensuring that health-related sustainable development goals are achieved and that there are measurable results. And this engagement of the private sector can be accomplished through investments in innovation that are specifically targeted on improving health, as well as ensuring that business engages with the public sector and civil society in a transparent way. The Sustainable Development Goals do elicit genuine public engagement, whether it's from global leaders or from school children. We're seeing the emergence of numerous activists for this new agenda, and people and governments throughout the world are adopting the goals as their own. But the 2030 Agenda will only succeed if people everywhere know that it exists and understands its significance to their daily lives. And then, having understood it, they need to act on it. And to get to this global understanding, we count on activists everywhere who can explain to others what the goals are and why they matter to people's lives. To do this, let's strengthen the voices of those who are leading progress in health in their own communities. In that way, we can take advantage of this time of immense opportunity. Vision that's based on health for everybody, access to health care for everybody, and no one left behind, will generate action that results in the health and well-being of everyone in our world. And this will be achieved through the 2030 Agenda for Sustainable Development. So, ladies and gentlemen, I wish you fruitful deliberations throughout your summit, and I thank you for this chance to share some ideas with you. Good luck.